Did you know that there is a different kind of hypothyroidism, one of which most doctors are unaware, which very commonly affects patients with ME-CFS or long COVID? My name is Patrick Usher. I'm an ME-CFS patient and author of the book Understanding ME-CFS and Strategies for Healing. And today I'm talking with Dr. Courtney Craig, who has spent most of her professional, academic and personal life learning about or dealing with ME-CFS. Now, Dr. Craig herself suffered from this kind of hypothyroidism and did very well with T3 replacement therapy. Now, for those of you who are familiar with treating hypothyroidism, you will know that the most common form of hypothyroid treatment is actually taking T4 or levothyroxine and not T3, which is liothyronine sodium, or the active form of T3. Now, I've done a whole previous video on the ins and outs of this kind of hypothyroidism, which is now linked up above. But it's not a treatment without risks, and I myself did T3 therapy for almost 3 years, and it actually made me worse by suppressing my cortisol production. But Dr. Craig also ran into some problems and had to make various adaptations in order to make this treatment work. So listen on to get her experience of what those adaptations were. Dr. Craig is also offering viewers of this channel 15% off her video courses on ME-CFS and nutrition strategies. Please use the code FALL15 to get your discount. This is just a discount code, it's not an affiliate link. Please check out the details in the description box below.
So at the time I was doing my clinical internship rounds, the last semester of my studies, and I happened to be in a integrative medical practice at University of Pittsburgh Medical Center, excellent facility. And I was working there with chiropractors, acupuncturists, and physiatrists, and all kinds of multidisciplinary care. And I was in the office one day, and there was a bookshelf, kind of like what's behind you there. And one book stuck out to me, and I picked it up, and it kind of changed the whole trajectory of my life. And that was Dr. Teitelbaum's book, From Fatigue to Fantastic. Just a big yellow book. And I was like, what is this? So I went home and I bought it on Amazon right away. And my head exploded. It started to really help me understand all of the aspects of the condition. So at the time, I just thought I had an immune disorder. I didn't understand that my hormonal issues, my digestive issues were all connected to the same condition. And that book put all of that together for me and helped me understand that this is a systemic condition, that it affects every system of the body. And in the back of the book, it happened to have a listing of practitioners who were specialists, and there happened to be one in my neighborhood. And I was like, this is like a divine moment. It was incredible. So I finally was able to find a specialist.
Brilliant. Yeah. No, I mean, that's it. That understanding that it is all interlinked, it is all systemic. We can go along thinking that we're dealing with lots of random problems, but it ain't. There may be some random problems, but it ain't like that. So great moment of divine revelation, finding Dr. Teitelbaum's book. And then you go to this doctor and tell us about the treatments that I hope from this point actually started to help you out from that lowest ebb.
Right. Yeah. And again, just having a practitioner who understood was just like the most amazing thing. I mean, such an emotional thing, that first appointment where you actually are sitting there for over an hour, like actually talking to the doctor. That's also rare to have that time. And that just that understanding was just priceless. So I did the full protocol of his book, which, of course, very expensive. No doubt about that. I don't necessarily, in hindsight, I don't necessarily know that all of it was necessary, but I do know the things that helped the most in that protocol. It was very intense protocol. I was getting intravenous therapy twice a week with a Myers cocktail, so very, very high dose vitamin C, and then also glutathione was given at the end. That was incredibly helpful for me. So I was within one treatment day, I noticed feeling better. Another big part of that treatment was also just getting testing that showed something. Of course, I'd had so many blood tests in the past and all of them were normal. But this time she ordered some different tests. And they actually were not very expensive functional medicine type testing. I didn't do any of that at the time. These were just basic blood tests that showed things that no one had ever looked at before. For example, no one had really investigated all of the chronic viruses like in depth. I mean, my Epstein-Barr was like off the charts, chronically, this immune memory. And also, she looked at my thyroid properly. No one had ever done that before. And those markers, again, were really, really high. So we started to address some of these.
Was that reverse T3, Courtney?
Yes,
Or yeah.
yes,
What was your
exactly.
result as a matter of interest? Do you remember?
Oh, I can't tell you the number. I don't remember, but it
Okay.
was, I mean, it was one of the highest she'd ever seen, apparently. I mean, maybe she just
Wow.
said that, but it was very, very high. And again, that's a sign of your body stuck in a stress response, that you're not converting your thyroid hormones properly.
And did you take T3 for that, or what did you do?
I did. I did. And that was also really, really helpful, immediately within just
Mm.
a couple doses. And I say that I noticed the change. I could tell in my skin, like my eyes, the dark circles started to lift. My skin was clearer, my brain was clearer, and I had more energy throughout the day. So that I attributed to the thyroid replacement.
That's fascinating to me, and I'd like to just pause on that for a moment. Like,
Hmm.
was the do you remember the kind of dosing schedule or how it was done? Because there's so many different ways that people go about T3 therapy, and I wonder, like, how is it for you? And did you come off it eventually, or do you still take it? Or
Yeah, so it was a compounded dose because you have to be very careful taking this. If it's too high, it can cause all sorts of problems. And I did actually have that occur because I had to titrate it down over time. So I started at a pretty high dose, and then like every 3 months or so, I would titrate down to a very, very low dose. And for instance, when I did not do that and it was too high, I started getting palpitations and tachycardia, and I had like a cardiac incident, which I knew was related to that. So that meant the dose was too high. So this is something that really has to be carefully dosed. It's going to be dependent from person to person, but it's not something I take anymore. I've actually haven't taken that for years, probably almost 10 years. I haven't needed to, I don't think. And I've had it retested and my levels returned to normal. That's also important to say.
oh, that's brilliant. Yeah. So I mean, that's the thing. I mean, if your reverse T3 is back normal, then there's no need to take take it. And in my own case, I took it for almost 3 years. But I actually think it may have caused me issues because it may have ended up suppressing my cortisol release. My cortisol levels became very low on it, and
Yeah. I will
yeah.
mention that I was taking low dose cortisone in conjunction with the T3.
Uh, that I think could make a difference. Yeah,
Hmm.
because the T3 shuts down your thyroid completely, and in the middle of the night, the adrenals normally get a stimulus from T3 to release cortisol, and so
Hmm.
if they're not getting that stimulus, your cortisol can tank, and that's what ended up happening for me. And I think I actually ended up feeling worse. And I know some people say you should take T3 at 4 a.m., your first dose at 4 a.m., in order
Oh,
to
okay.
kickstart the cortisol at the same time.
I
And
haven't
some people who
done
didn't do well with T3 in general did amazingly when they started taking the first dose in the middle of the night.
Interesting. Haven't
Um,
heard that, but it just goes to show like anytime you're taking anything for hormones, it's a very delicate balancing act that should be done under serious care and like recheck the levels and work with the doctor because yeah, you can throw things off and make the whole thing crash down.
yeah, you absolutely can. And I didn't even realize that was happening to me for quite some time. I had to work it out myself. This video is sponsored by Turney, the new artificial intelligence sidekick designed specifically for a select group of illnesses, including ME-CFS and long COVID. Now, Turney is not another ChatGPT. Instead, the platform has indexed pretty much every single paper, every single conference, every single transcript from a YouTube or podcast discussion in relation to ME-CFS and long COVID from the last 10 years. So when you ask Turney a question, you really get a very detailed answer from a wide variety of sources, which allows you to make the best possible decision for your own health. It is just $2 a week, but you can get a further 10% off using the code Patrick10. Please follow the links down in the description box below. The first 3 weeks are entirely free.